healthcare industry analyst, for a discussion with Caitlyn Donovan, partner, General Catalyst.
Hello, folks, and thank you for the pleasure of being one of the first panels today. I am very pleased to be introducing Caitlyn Donovan, and you probably know me as probably number one in your inbox by volume from all of my spam for all of the different health tech research since meaningful use was a thing. So I would say I identify now as operationally curious. Caitlyn, you have had an amazing career, and you're now on my side, the investment side. Tell me how you got there.
Turns out I was investing curious. So
look at that.
So I'm now a partner at General Catalyst, which is a large venture capital firm that really spends a lot of time focusing on healthcare, and really invests not just in the capital solutions that we have to pick the right new disruptions to healthcare, but also in a flywheel to help incumbents come along to really drive change in the ecosystem. And prior to that, I was an operator. So I spent the past 12 years at healthcare companies, always at specialty benefit managers, which can only exist in the US because our system is so complicated, but would sell into payers, manage a provider network, have some form of patient-facing tool. Most recently at Uber Health, which did this for transportation, prescription delivery, grocery, and over-the-counter benefits. So I can say firsthand, I see how broken our system is across all of those different facets.
A great way to start it off. Look, a lot of folks are looking as brokenness that can be fixed with AI. It's like a big theme that we're going to be talking about a lot. I think we're going to be discussing more at this forum. But I think when you hype AI as a way to reinvent healthcare, you have to actually look at how it affects the groups that are really trapped most in healthcare, right? So talk to me. How do you think about this for patients, providers, and payers?
I think that is exactly the right question. And in general, I'm so excited. I think we all are, which is why we're here, about the potential for AI in healthcare. I know as a patient and resident hypochondriac, the first place that I go when I need to answer a healthcare question is to ChatGPT or Claude.
We're done with Dr. Google.
Exactly. It's so much more efficient. They probability weight what could happen to me. And I think that's really just from the patient experience. But then, to your point, this is a really complicated ecosystem. It is why my old jobs at specialty benefit managers exist, because it's so hard to navigate different insurance companies, providers, the multitude of providers that you need to go to get care. And I think that when we see what AI can do, it's really a couple of different buckets. One is, how do we think about the workforce and how to serve patients' needs, coming from a place of abundance instead of scarcity? I think we've all heard about the nursing shortages, the workforce shortages. This really gives us the opportunity to have folks work to the top of their license. Second, how these groups interact together. We know that we spend 20% of our GDP on healthcare, and 30% of that is administrative cost instead of patient care. And having lived, by definition, in the middle of payers and providers interacting together, there's so much we can do, not just from a let me make this step 10% more efficient, but fully eliminating steps altogether to reduce that burden. And three, I think the biggest impact that we can all have together when we think about technology is not just the internal, how do I accrue value to myself by finding the lowest hanging fruit and making it work? It's how do I fundamentally change this business model so that it runs more efficiently from beginning to end? And the one thing that's missing that I think most incumbents have talked about for a long time but have not executed on is truly meeting patients where they are. I spent a lot of time in my former roles talking to payers, talking to providers, and they'd talk about their digital front door. But the assumption there was that the patient...
Everyone has that door.
Everybody has that
right?
door. The poor patient must be stuck in one of those, Charlie and the Chocolate Factory with all the buttons and the...
And everyone's grabbing them, get through my door.
Exactly.
Ignore that door.
Exactly. And I think that's such a key, right? If your definition of meeting patients where they are is in my app, you really aren't. And I think leveraging that natural instinct, like me as a resident hypochondriac, to go to the OpenAI or the Claude or the model of your choice really provides a new way to simplify the ecosystem and really meet patients where they are.
What do you think about some of the recent regulation that's been coming out where folks are starting to use OpenAI so much that they're thinking, oh, well, maybe you can't use that for therapy? Do you think that kind of bleeds into other levels of the clinical experience and this gets relegated to admin?
I think, especially in healthcare, safety is the most important thing. But just like with anything else, whether regulation or process or new tool, using a scalpel instead of a hatchet really matters, where understanding the purpose, making sure safety's in place, making sure that things are checked, there's no hallucinations, et cetera, I think that we need to continue on. And to the earlier point, there's just so much low-hanging fruit that can come from the simple things, like the administrative tasks, like a triage system to get patients to the right place, that I think we can build up the reps and the data that prove that these clinical models really work as well versus having a binary outcome.
And let's also not forget, yes, it may have hallucinations. Yes, you may have something where it's only accurate 90% of the time, and maybe the doctor is accurate 95% of the time. And these are both very hopeful numbers, but it's a lot better than not having care.
Completely agreed. And I think finding the appropriate middle ground where what can be autonomous, what needs a co-pilot, what always needs a human, to me is the level of nuance that we really need to make sure that we're capturing all of the value these really powerful new tools bring us, given how broken and expensive our system is today. We sort of don't have another option.
Now, we're talking a lot about this broken system, and I get really worried when we talk about something like a magical Band-Aid fix-all, because I remember when we talked about that for EHRs, you can't manage what you can't measure. Well, we've measured a lot, and there's not a lot going on. I remember value-based care, that was supposed to be the wave of the future, and I wrote about that, I want to say, since like 2010, and we're still going on now. Is this the magical Band-Aid, or we've got a lot of people in the room that seem like they're in policy. Do we need to just shake that Etch-a-Sketch with the system?
I think that is so well said, that especially when we have a very large and complex ecosystem, nothing will ever be a magic Band-Aid. And that's why understanding not just what the technology can do, but what the business model would be on a blank sheet of paper, now knowing that this exists, but then equally importantly, what are the micro incentives that exist in the ecosystem to drive this forward? And just to give an example from value-based care and sort of where things fell forward, because I think there's a really interesting analogy to AI. When I was at Uber Health, often the things that you'd need to drive value to get patients to preventative appointments or prevent an ER crash, they'd need transportation to that appointment. And it was often the patients that couldn't self-navigate that needed the most help. So we contracted with almost every payer, almost every value-based care company. And one of the micro incentives that we very quickly figured out is that the pocket of money that these value-based care companies were paid to keep patients healthier was completely separate from the pocket of money that they used to drive those behaviors. So we were contracted with a value-based care kidney company, and there was a patient who needed preventative care. They were worried they were going to crash into dialysis. It would have cost an $80 ride. Because that was controlled by a different group at the health plan. They called us up, this is a true story, and said, "What do I do?" And our response was, well, this is why you contracted with us. It's the right thing to do. It's the right thing to do for the patient. You send them the ride.
Or you're like, so $80 is a lot less than $1,000.
Exactly. And that poor patient is going to have a bad outcome, right? And they said, oh, I can't do it. The insurance company will be mad. And I think our direct quote was, I guarantee they will not be mad. They didn't do it. Patient crashed into dialysis. To your point, an $80 ride turned into a $1,000 ambulance ride. Never mind the hospital stay. Very mad patient, very mad insurance company. So that idea of value-based care, of doing the right thing for the patient from a financial perspective, the micro incentives got in the way. And that's where I really worry about AI, where if we all solve for our portion of the business model separately, I think we'll miss the big opportunity. And so watching forums of payers with providers and patients coming together to map out the future, I think is what's going to make this not a failed endeavor.
So to that same point, though, there's a lot of mouths to feed in healthcare, and a lot of them have these little funky incentives within them. What do you think is the biggest barrier to having us all come together before?
I think very often folks are self-focused and optimized for the near term versus the medium to long term.
Yes.
So I've observed this as a COO or CEO of startups, where the inclination is to own the entire experience. And so often, if you are thoughtful about what you're great at and where you need to partner, you can make a bigger difference in the ecosystem and then sort of drive the right behavior. Very tactically, when I was at Uber Health, we made it economically irrelevant whether we were behind the scenes or the consumer front end, and that is how we grew 10x in 3 years. I think that's what needs to happen here, both from the founder side and then also from payers and providers. There's that desire to own 100% of the experience, but thinking about, patients go to OpenAI, not my app. How do I get them to where they need to be, knowing that's the front door? Or, really, these transactions between payers and providers are probably a utility. How do we set that up as a utility? I think will accrue value to all, and you can work out the economics so it makes sense, but you have to be planning for that medium term first.
I mean, it's the whole swan song of digital health, right? Mm-hmm. We're going to create a bunch of new disruptive healthcare. We're going to have it sit on an island. We'll have it interact absolutely in no way with your existing provider. And then we're shocked that it doesn't work.
Exactly.
Like, wow, what a surprise.
There's an app for that, right?
There's an app for that. You should remember that during your worst moment when you're having a health crisis.
That's exactly right. Exactly right. And all your passwords, right? Yeah.
So who would you implore more to make a change on this? Is it the incumbents that are saying, I don't need to go and deal with these disruptors, I want to own everything? Or is it the disruptors that are always cautious to partner or consolidate?
I think this is maybe the first time, at least in my career, that I've seen glimmers of folks doing the right thing, right? On the incumbent side, every payer and health system I talk to seems quite genuine when they say, we know change is required and here's what needs to happen to make it work. I think it gets harder when you get into the department who's going to become obsolete with this change, and so there's a lot of internal change management that's required. And similarly, the startups, at least in our portfolio, are so inclined to work together in a way that we haven't seen before that is incredibly exciting, where we always use the analogy of patients need a car. They don't need a steering wheel and a tire and a directions manual of how to put this together. So let's do that for them. And again, that willingness to make that work, I think, is really exciting. I think the devil's in the details of that strategy is there, that talk track is there, but focusing on the execution and making sure that that middle level of the organization knows that they'll be rewarded for putting themselves out of a job. That is most key to pulling it off.
I do really relate to that, because I remember when OpenAI first came out, I thought, oh man, being a research writer is not going to be a great career path. there's a lot of risk here. But I also always wondered why the banks didn't embrace Gen AI and say, you know what, we have a unique ability where we have every research analyst's brain on paper, feed it in the machine and see what happens. Get some cost takeout out of that, make it more efficient. Now, I know we could probably talk about this for forever, but I do want to make sure we have time for audience questions. Do we have a microphone, Chris? All right, perfect. I guess raise your hand if you have any questions for the lovely Ms. Donovan. Otherwise, I'll keep rambling. Silence. All right, well, until someone asks, oh, look at that. Wait for the mic.
Maybe you could just highlight some of the investments that you made that you're really excited about.
Happy to.
And especially anything that K Ventures also invested in.
No bias at all.
Very, very good question. I think there's so many themes that we're really excited about. Where I tend to get particularly excited is the themes that we've just talked about now. What fixes infrastructure to make it easier for patients, providers, and patients to interact, new care models that really have that meeting patients where they are, that I think are really exciting. A couple examples of that, I think Gollum, who's here, we are both on the board of a company called Soda Health that is super exciting, where it's fintech rails that make it easier for patients in the moment where they are, using health plan dollars or SNAP EBT dollars, know what they need to do to stay healthier. They don't need to go somewhere else. It, again, is truly that meet them where they are. I've invested in another company called Ecton that makes HSA rails run more smoothly, where with high deductible plans increasing, how do you align those micro incentives of the ecosystem where, you know, obviously it's good for health plans to shift more of the cost to patient pay. Providers, it's trickier because there's bad debt and patients have an information mismatch in when they know they have an HSA and when they really get a bill. And so they have a really elegant fintech solution that solves for that. I think those are the only two that are public right now that at least I've personally made. But GC in general tends to focus on, you know, provider-facing tools, those infrastructure plays, new care models. We have over 500,000 lives in value-based care that hopefully is coming together in a way that works.
One day.
Again, trying to advance those themes.
On that note, there has been a lot of payments innovation recently. Like, I've been surprised at the level of payments innovation in healthcare. Why do you think now is the time? Is Gen AI accelerating that at all?
I think yes. So I've been following this trend for a number of years where, you know, if you think about how healthcare works without payments innovation, you naturally have a 90-day information lag, right? Yeah. You as the patient, you go to the doctor, you don't know if something's covered, you come back when you find out it is, you have your procedure, it gets coded in a certain way, they fill out a claim, it gets submitted,
I get mail that says this is not a bill.
Exactly.
Why did you mail it to me?
That's exactly right. That's exactly right. So all of those 10 plus steps happen for almost every single transaction behind the scenes. And that is why 30% of our spend is administrative. I think coming back to the point of there could be a temptation to take each of those 10 steps and make them incrementally better, but really those 10 steps are based on the exact same set of data that you could receive at the point of care versus 90 days later. And to really effectuate that change and collapse those steps into one, you need that payments innovation to make that work. And so I think that's why we've been seeing so much payments innovation in general. And then coupled with the fact that there's been just an increase in higher deductible plans, which require payments innovation to make it more accessible to consumers, in addition to new regulations around ICHRA in particular, and migrating from a defined benefit where you know here's everything I get in my health plan to a defined contribution where you effectively have to invest those dollars yourself. that becomes a hard fintech problem and a hard consumer engagement problem that requires that innovation.
We got a question up here. And we got just a few seconds left in order to answer it.
Hi. What areas of the application of AI to healthcare are you ruling out? Because either the competitive landscape is too murky and hard to figure out, or you just think the technology market fit just won't scale to a point where you can generate an attractive return?
That is a great question. And my answer is very not specific because I think we are so early in this AI journey that having preconceived notions, we would miss things and miss the opportunity to really drive lasting change. What I will say when founders pitch me, it all comes back to this business model innovation. I think the number one thing I get pitched on is folks coming saying, did you know AI could be really helpful for this one tiny step in this one tiny process? And so I try and think of founders that have a point of view on what a business model should look like, what the industry should look like, and how to get there. But I think there's so many opportunities that I wouldn't exclude any potential there. Great.
Well, that's all the time we have.
Thank you so
much.
much. Yeah.